I'd like to thank you all for coming tonight. My name is Michelle Kemp. I'm going to talk to you all a little bit about cholesterol levels and heart disease. Many of us have had someone close to us who has had heart disease or has had a heart attack. How often have we heard someone having a heart attack or stroke that our first thought was it was only a matter of time? What makes us think that it was only a matter of time for them? Was it their lifestyle? Stress plays a very high risk factor in heart disease. Not getting enough exercise, poor eating habits, use of tobacco, intake of excessive alcohol, never having their cholesterol levels checked. Let's ask ourselves, when was my last visit to my physician? I get on occasional exercise kicks, but they don't last. Does one think they are not overweight or safe for heart disease because they're thin or because they eat right? Sometimes it's in our families and we just don't know it. Now that we've asked ourselves some tough questions, I can share some things with you all to help you maybe change your lifestyle a little bit, maybe prevent you from having a heart attack or a stroke by just knowing what your cholesterol levels are. First thing is to make a visit to your physician to have a cholesterol screening done. And they will show you, over here you can get a better look afterwards of what is normal and what is considered high with your cholesterol levels. What high cholesterol does, this is a normal, healthy artery. Your blood levels can flow freely through. When you have too much plaque built up by your triglycerides, which is your bad cholesterol, it clogs your arteries. Therefore, your blood can't flow to your heart quite as smoothly as it does when you have normal, free-flowing arteries. So what we can do is, once they tell you what your levels are, there's many different things that you're able to do. You can go on some type of an exercise program. The American Heart Association recommends maybe, just to start with, 3 times a week, a 30-minute walk, just a nice brisk walk, 30 minutes a day. Of course, they're going to tell everybody to stop smoking. That's one of the things that they like to impress upon everybody. This group, I know it's entirely different. They will mainly tell you about your diet and your eating habits. To really stick with things that are more whole grains, have your beans, have your whole wheat bread, low-fat dairy products. Limit your sugars. That's where the alcohol factor comes in. If you have too much alcohol, it's very high in sugar, and the alcohol actually will cause your blood to not flow freely through your heart valves also. They will put you on an exercise program, as I mentioned earlier, talk to you about your eating habits, your stress levels they will try to keep down. Some people, they prescribe a little bit of extra medication to help control your triglyceride levels if you can't control it with diet. There's some people that you can try with diet, you can try with exercise. You go back to your physician for another checkup because they'll want to monitor it sometimes 3 months, 6 months, sometimes every year. And they may find that you can't do it alone. You can't do it just with your diet. You can't do it just with your exercise. And that's when they will go on ahead and put you on a prescription medicine that maybe you take once a day. And it keeps your blood flowing freely. The buildup of plaque and cholesterol levels in your arteries is what causes heart attacks and strokes. So if we're aware and monitor our cholesterol levels, then we can prevent ourselves from having a heart attack or heart disease. Thank you.